Welcome back to this next video in which we are discussing schizophrenia. Okay, so we've now been through what schizophrenia is and we've been through the positive and the negative symptoms of schizophrenia. What I'd now like to go through is the different types of schizophrenia. So, as I said right at the beginning of this video, people often classify schizophrenia into 4 different types, and I'll start off by writing down the names of the 4 different types, and then I'll describe the major symptoms that are characteristic of each of the 4 different types of schizophrenia. And I want to reiterate at this point something that I said earlier, which was that we've now been through a massive great list of symptoms of schizophrenia. We saw the major 2 categories of positive symptoms of schizophrenia, hallucinations and delusions, and we've seen all of those different negative symptoms of schizophrenia. And I said earlier on that an individual with schizophrenia will not have every single one of the symptoms on that list. Each individual with schizophrenia has a different collection of those symptoms, and these different types of schizophrenia are characterized by different combinations of those symptoms. And when you're trying to decide if you've got someone with schizophrenia, which of these 4 types of schizophrenia they fall under, it's which one's the best fit, basically. Which are their major symptoms, which are the most pronounced symptoms that they're experiencing, that they have the biggest problem with, and then try and fit which one of these types they fall best into. Okay, but it's not incredibly important to fit an individual with schizophrenia into one of these 4 different types. However, you will see a lot of people who do fall into one of these 4 types, so I'm going to go through it. Okay, so the 4 types then of schizophrenia. So the 4 different types, we'll start off with paranoid schizophrenia. So the first type is paranoid, and in fact I think I'll just list them out first and then I'll go through the what each of them is, although you can probably gather already what paranoid schizophrenia is going to be all about. Next type is hebephrenic schizophrenia. Third type is catatonic schizophrenia. And finally, there is simple schizophrenia. Okay, so let me go through what these 4 different types of schizophrenia are then. So we'll start with paranoid schizophrenia. So in paranoid schizophrenia, the individual will be suffering from auditory hallucinations that are usually third-person auditory hallucinations, and they will have delusional beliefs that they are being watched and that people are plotting against them. So the delusions of persecution, and usually along with third-person auditory hallucinations, are the major symptoms of paranoid schizophrenia. In addition, they might have negative symptoms of schizophrenia, such as social withdrawal and not wanting to go out, for instance, and potentially self-neglect. And they might explain the social withdrawal as being because they don't want to go out where people can watch them. And indeed, they might keep their curtains of their homes drawn all the time so that people can't look in at them or spy on them. But in paranoid schizophrenia, the major symptoms then are the delusional beliefs that they are being watched and that they are being plotted against, and these beliefs are most likely there to explain the auditory hallucinations, where they can hear people talking about them, maybe making comments about their lives, and they will explain these voices as being because potentially someone has implanted a computer chip into their brain to monitor them, and that it's misfunctioning potentially, and that's why they are now able to hear what the computer chip is saying. Other people who are listening to them are saying. Okay, so paranoid schizophrenia, the major symptoms there are delusions of persecution and along with auditory hallucinations usually. Okay, next, hebephrenic schizophrenia. Hebephrenic schizophrenia. The major symptom of hebephrenic schizophrenia is disorganization. So this is also sometimes called disorganized schizophrenia. And the major symptoms here, as I say, are disorganization, and this means disorganization in multiple different ways. So disorganization in thought. So loosening of associations is one of the major ways in which disorganization manifests. So for instance, they might have quite severe flight of ideas. When you're talking to them, they might be jumping from idea to idea to idea, and it doesn't seem to make much sense. Indeed, their speech is extremely disorganized. In addition, because of the lack of the ability to make decisions, their life might be extremely disorganized. They might not be reliable at turning up to things, etc. So disorganization, disorganized thought, and disorganized decisions is the major symptoms of hebephrenic schizophrenia. Catatonic schizophrenia, the major symptoms there are the apathy and the psychomotor retardation. In catatonic schizophrenia, the psychomotor retardation has got so bad that the person is almost in a stupor. They're not unconscious, but they might not be saying or reacting at all. They might just be staring blankly. If you talk to them, they might not reply at all. So that's what catatonia is all about. I'll just write that word down. So catatonic schizophrenia comes from the word catatonia. And catatonia means that you're in a conscious stupor, effectively. You might just be sitting there, not responding to anything around you, but conscious. You're not unconscious, you're not lying flat. Your eyes might be open, but you're just not capable of responding to anything. So the major symptoms there are psychomotor retardation, allergia, and the apathy, the inability to actually do anything, to attach salience to motor plans and do anything, so that you're effectively catatonic. So where those symptoms are incredibly severe, that's what we would call catatonic schizophrenia. And I have seen an individual suffering with catatonic schizophrenia before, so it's not unheard of. And then finally, simple schizophrenia is a really important one to know about, because in simple schizophrenia, you absolutely do not have hallucinations or delusions usually. Only the negative symptoms of schizophrenia are there in simple schizophrenia. So we've talked about these other three. Paranoid schizophrenia, I told you that the major symptom there is the hallucinations and then the delusions which result from the hallucinations. These other two that we've talked about, hebephrenic and catatonic schizophrenia, we've talked about how they're characterized by these negative symptoms. However, it's not part of the definition for hebephrenic or catatonic schizophrenia that you don't have any positive symptoms of schizophrenia. It's just that the most obvious symptoms, the most debilitating symptoms of the disorder in these cases are the disorganization in hebephrenic schizophrenia and the catatonia in catatonic schizophrenia. However, in the definition of simple schizophrenia, you do not have positive symptoms. Okay, so you do not have hallucinations and you don't have delusions. You just have the negative symptoms. So often, the way that simple schizophrenia would present is with someone who is no longer going out and doing things, so has become very socially withdrawn and apathetic, and when you talk to them, you don't get much of a response. You might just get one-word answers, so the allergia is there. So it's characterized by the negative symptoms. However, it's not as severe as the catatonic schizophrenia. The catatonic schizophrenia, you're in a stupor, you're completely unresponsive. If you're suffering with simple schizophrenia, you will still respond to people talking to you. You just might not give very big replies to what they're saying and not want to go out with them and not do anything. So it's not as severe as catatonic schizophrenia, and the loosening of associations isn't as apparent as it is in hebephrenic schizophrenia. But the key to simple schizophrenia is no positive symptoms. So I'll write that down. So only the negative symptoms of schizophrenia. And I'll restate what I said earlier, that although the classic symptom that people think of when they think of schizophrenia is the auditory hallucinations, you do not need to have auditory hallucinations to be diagnosed with schizophrenia. Simple schizophrenia is a classic example of where you do not have any positive symptoms. So, No positive symptoms in simple schizophrenia. Okay, so those are the 4 different types then of schizophrenia. Right, so we've now been through what is schizophrenia, we've been through the different symptoms of schizophrenia, and we've now been through the 4 different types of schizophrenia. So what I would now like to talk about is how do we treat people with schizophrenia. So let's put this up here. So, treatment. So I talked a little bit earlier on about what is the cause of schizophrenia, and one of the major things that puts you at a huge risk of developing schizophrenia is the use of recreational drugs, particularly cannabis, but other recreational drugs as well. And as I said earlier, even tobacco and alcohol are now being acknowledged as risk factors for developing schizophrenia. So one of the key things in the treatment of someone with schizophrenia is to try and stop them using recreational drugs. Because really, unless they give up using cannabis or whichever other recreational drugs they're using, it's going to be very, very difficult for them to recover whilst they're still using the recreational drugs, because they are most likely one of the key things that is actually causing the problem with the brain that leads to the aberrant salience. So we need to get rid of the cause, the thing that's damaging the brain, and then we need to try and repair the brain. So I'll put as one of the key treatments for schizophrenia stopping using drugs, so giving up recreational drugs. Then, after whilst you're succeeding with doing that, you then need to try and rehabilitate the person. So you need to try and get them to go out places and engage with society again. So you need to try and treat the social withdrawal by actually taking them out and doing things with them, so that the brain can get used to doing this again and can hopefully start to actually repair, so that it can attach salience to thoughts in the normal way again. Remember, the brain is incredible. It is incredibly plastic and it can recover from this. But the only way to make it recover is to expose it again to normal activity, so that it can get used to attaching salience to normal thoughts and attaching salience in the correct way, rather than in this broken way that it is now doing it. Okay, so giving up recreational drugs and then rehabilitation is extremely important. Rehabilitation. Those are, if you like, the 2 long-term treatments for schizophrenia. Giving up the recreational drugs that is most likely one of the key things that has actually broken the salience machine in the first place, and then rehabilitation therapy to try and fix the way the brain is attaching salience to thoughts again. However, what I now want to talk about is a short-term treatment for schizophrenia, which can become longer-term treatment if necessary, which is antipsychotic drugs. Now, these are called antipsychotics rather than anti-schizophrenic drugs, and with good reason, because they do not cure schizophrenia. What they do is they get rid of the psychotic symptoms, and they get rid of the psychotic symptoms extremely effectively, but they do not get rid of the negative symptoms for the main part, and in fact many of them actually make the negative symptoms worse, and I'll explain why in just a moment. So, let's now discuss antipsychotic drugs. Okay, so when we're discussing antipsychotic drugs, we divide the different drugs into 2 different categories, which are the first generation antipsychotics and the second generation antipsychotics, and I'll put those as the 2 headings. So we have first generation and then we have second generation. Now there are some slightly less correct terms that people will still use for the 2 classes of antipsychotic drugs. The first generation antipsychotics are sometimes called the typical antipsychotics, and the second generation antipsychotics are sometimes called the atypical antipsychotics. However, if possible, it's better to call them the first generation and second generation antipsychotics rather than typical and atypical. However, you will still hear people using these names, so that's why I give them to you. Okay, so First generation and second generation antipsychotic drugs. I'll explain what the difference between the two is later on. So, what do antipsychotic drugs do? Well, really, what they do is they turn the salience machine in the brain completely off. And this is the way that they get rid of the positive symptoms of schizophrenia. So let's just remind ourselves, schizophrenia is a disorder of volition. The machine inside the brain that attaches salience, importance, to thoughts is broken. And this is giving rise to two categories of symptoms: the positive symptoms or the psychotic symptoms, which arise because thoughts that shouldn't be receiving salience are getting it because the machine has broken. And then it consists of the negative symptoms, which arise because thoughts that should be receiving salience are no longer getting it. What the antipsychotic drugs do is they just effectively turn off the salience machine. Okay, they turn it off. They say no thought is going to get salience attached to it. And that gets rid of the psychotic symptoms fantastically, because it now means that we're not going to attach salience to those thoughts that shouldn't have received salience, so the voices and whatever other hallucinations go away. And the delusions also go away, because remember, the delusions, depending on which interpretation you follow, were either caused directly by aberrant salience in the first place, or they resorted secondary to the hallucinations. And if the hallucinations go away, then hopefully the delusions can go away as well. So they are fantastic at treating the psychotic symptoms, hence why they are called antipsychotics. So now, of course, we turn to the negative symptoms. Are these going to help with the negative symptoms? And the answer is no. If anything, they're going to make them worse. And indeed, that is what the antipsychotics, many of them do. They do make the negative symptoms worse. They make the social withdrawal worse, and the psychomotor retardation worse. And indeed, if someone who wasn't suffering from schizophrenia was to take an antipsychotic drug, they would most likely get horrendous negative symptoms of schizophrenia, because their ability to attach salience to thoughts would be hugely reduced by the drug. Okay, having said that, we can now come on to the difference between the first and second generation antipsychotic drugs. The first generation antipsychotic drugs are horrendous for making the negative symptoms worse, okay? Whereas the second generation, they're slightly better. They don't make the negative symptoms worse in the same way that the first generation ones do. And in some cases, for the second generation antipsychotic drugs, we actually think that they can help improve some of the negative symptoms. So that's the key difference between the first and second generation antipsychotic drugs. The first generation ones really do just turn the salience machine off, and that gets rid of the psychotic symptoms fantastically, but it doesn't help the negative symptoms. In fact, it's going to make them worse. The second generation ones, they do that as well. They do turn the machine off, but they do it in some incredible way where it doesn't actually make the negative symptoms worse, and in some cases we actually think it might help the negative symptoms. But still, we don't have a drug that will completely return you to normal and get rid of all the negative symptoms. We have fantastic drugs for stopping you hearing voices and stopping you seeing things that aren't there, but we don't have drugs that can help with the negative symptoms that much. And that's why rehabilitation is really important, and cessation of recreational drug use is really important, so that the brain can actually repair and the salience machine can repair, because that's what these drugs are not doing. They don't fix the machine, they just turn the broken machine off effectively. Okay, right, so let me now discuss some examples of the first and second generation antipsychotic drugs. So I'm going to select some examples to actually name some of the interesting examples, because there's absolutely loads of these different types of drugs. Most of them are obsolete and aren't used anymore. So I'm just going to mention ones that are either interesting for historical reasons or are important because they're still actually used. So I'm only going to mention the ones that have an interesting story. So we'll start with the first generation antipsychotic drugs. Oh, and the other thing that I'll mention is the different side effects of the different antipsychotic drugs. Okay, so We'll start with the first generation antipsychotic drugs. So the one I absolutely have to start with, not because it's actually still used, but because it was the first one, is chlorpromazine. So, as I say, this drug is no longer used. You will never see anyone prescribed chlorpromazine, at least not in the UK. However, people expect you to know the name of chlorpromazine because it was the first antipsychotic ever to be used, ever to be discovered, and it's the one from which all the others were developed. So it's very important for historical reasons. So we'll start off with chlorpromazine. So the next antipsychotic drug, first generation antipsychotic drug that I want to talk about, is actually still clinically used, and it's a very important one, and it's Hallow paradol. Very powerful drug, very strong drug, old drug. It's not a new drug, it's an old one, but it is very effective. It does stop you hearing voices, and it does stop you seeing things, and it helps with the delusional beliefs. So it's a very good antipsychotic drug. We'll talk about its side effects, the major class of side effects for the first generation antipsychotics, once I've listed off all the ones that I want to go through, because haloperidol causes a lot of that category of side effects. But I'll talk about that in a moment. Okay, so next up, I want to talk about zuclopentixol. Now this again is still used, and there's lots of different forms of zuclopentixol, and I'll just go through these different forms. So there are 3 different forms of zuclopentixol. There's zuclopentixol acetate, there is zuclopentixol decanoate, and there is zuclopentixol dihydrochloride. Now, this is a good antipsychotic. It's very good at getting rid of hallucinations and delusions. However, it's got another use, another positive aspect to it, and this is really why zuclopentixol would be used over other antipsychotic medications. So why would this be used instead of haloperidol? Well, the cases where you'd use zuclopentixol is if someone's being violent. So if you've got someone who is behaving very violently and aggressively, and potentially they have been sectioned, they're in a psychiatric hospital, and the nurses are finding it very difficult to handle this patient because of the aggression and the violence, then they would prescribe zuclopentixol rather than a different antipsychotic, because it's absolutely fantastic at reducing aggression and reducing violence. And that is an effect potentially that is separate to its antipsychotic effect. So it has an antipsychotic effect getting rid of hallucinations and delusions, but it also has this incredible effect of preventing aggression and preventing violence, which it does better than other antipsychotics. Okay, so now to talk about these 3 different forms that it comes in. So zuclopentixol acetate and zuclopentixol decanoate, those are both intramuscular injection forms rather than a tablet that you take. And these are the forms that can be given if someone isn't going to comply with taking the medication. So if you've got someone that is being very, very aggressive, potentially they're demanding to leave the psychiatric hospital, and they're trying to force their way out, then they're not going to take a tablet if you give it to them. They're going to throw it away. And in those cases, forced medication may be the only option, and that's when intramuscular injections can be used. And zuclopentixol acetate is the form that would be given in that situation. It's a very quick acting form, a quicker acting form than zuclopentixol decanoate. And indeed, it has a brand name, and the famous brand name for zuclopentixol acetate is Accuphase. So Accuphase is an injection that is given intramuscularly. So I'll just write, it's an intramuscular injection, and it will be released from the muscle gradually, and it will have a reasonably quick effect in calming the person down and reducing aggression. Okay, so it's used in emergency situations such as that. Zuclopentixol decanoate is also an intramuscular injection. It's got a very famous brand name as well. It's called Clopixol, and it's an intramuscular injection as well. It's longer acting. So zoclopenthixol decanoate lasts for a few weeks. You inject it, and it will have an effect for a few weeks. It will release gradually over a few weeks, and this would be used in a different situation to Accuphase. Accuphase is used acutely when you've got someone who's being very violent towards the psychiatric team, and they can't control this person, and they would then use zoclopenthixol acetate to calm them down and reduce the aggression. Zoclopenthixol decanoate is given when someone is not necessarily very good at taking their medications in tablet form. So they're not going to comply, maybe because they forget, or maybe because they don't actually want to take the medication. It's then very difficult to get them to take a tablet on a daily basis. So instead what you can give is an injection that lasts for a few weeks, and then that only has to be given every few weeks rather than every day, and that means it's less of a big deal for the psychiatric team and also the patient who doesn't actually want to take the medication. It's less distressing for everyone. So it again would be used in someone who was liable to aggression and violence as well over another choice of antipsychotic. And finally, zoclopenthixol dihydrochloride is a tablet rather than an intramuscular injection. It's also called Clopixol, but as I say, it's a tablet rather than an intramuscular injection. And this would be given to someone when you have got compliance. So it would be given again because the person is liable to aggression and violence. But if the person is compliant with taking the medication, then they can take it in tablet form, and in that case they'd be using zoclopenthixol dihydrochloride. So those are the 3 different forms of zoclopenthixol. But again, remember that the key use of this drug over the other antipsychotics is if you've got someone who's behaving very violently and aggressively and you need to calm them down and get rid of the aggressive behaviour, zoclopenthixol is the antipsychotic of choice. The final antipsychotic I want to mention that is a first-generation antipsychotic, and I'm mentioning it because it is still prescribed. It's one of the few first-generation antipsychotics that I've actually seen prescribed. It's the last of the first-generation antipsychotics that I've actually seen prescribed. Hallow, paradol, zoclopenthixol, and this final one. So this is why I'm mentioning this one, which is flupenthixol. And again, it's a first-generation antipsychotic, so it has the classic side effects of first-generation antipsychotics, which I'll come on to in just a moment. So there are loads of other first-generation antipsychotics. This list goes on and on. However, these are the ones that people expect you to know about. Haloperidol, zoclopenthixol, and flupenthixol, they're the major first-generation antipsychotics that are still actually prescribed. And chlorpromazine everyone expects you to know the name of because it was the first one, so for historical reasons. Okay, so let me now talk about the key side effect then of the first-generation antipsychotics. So we'll come over here and have some space. So the absolutely key side effect of the first-generation antipsychotics is the extrapyramidal side effects. So we'll talk about this here. So these, for short, are abbreviated down to the EPSEs. So EP is for extrapyramidal, and SE is for side effects. So this is the side effects that it has on the extrapyramidal motor system, which is the motor system beyond the primary motor cortex. So the extrapyramidal side effects. So these are motor side effects. They affect the motor system. And the key thing that can result because of these antipsychotic medications is drug-induced Parkinsonism. So I'll write this down here. So it gives you symptoms very similar to Parkinson's disease. Whoops, let me just get my rubber. Drug-induced Parkinson disease, or drug-induced Parkinsonism. So drug-induced Parkinsonism. So the key symptoms then of Parkinsonism are slow movements, difficulty in initiating movements, these sorts of things, and that's what these drugs can actually result in. So drug-induced Parkinsonism. Right, So as I say, Parkinsonism involves slow movements. So the fancy word for slow movement is bradykinesia, and difficulty in initiating movement and consequently very little movement, so reduced movement, which we can call hypokinesia, although you could also call it psychomotor retardation if you liked. Okay, so bradykinesia and hypokinesia. And these, as you will notice, are reasonably similar to some of the negative symptoms of schizophrenia that we've seen, and that's because it's a very similar idea. So the reason that this occurs is when you want to initiate a movement, you need to attach salience to the motor plan. You need to potentiate up that motor plan. It needs to receive potentiation. It needs to grow in size in order for that to actually be initiated. And we've discussed that what these drugs are going to do is they're going to turn off the salience machine, and that then leads to it becoming very difficult to actually initiate movements and for motor plans to be or receive salience very slowly and therefore to slow movements. So this is why you get this drug-induced Parkinsonism. And indeed, in Parkinson's disease, the portion of the salience machine that controls motor plans gets broken because of the degeneration of the substantia nigra pars compacta neurons. So these drugs effectively give you a form, they give you the same symptoms as Parkinson's disease. However, the key thing is that when you come off these drugs, the drug-induced Parkinsonism can actually go away. Whereas in Parkinson's disease, of course, you've lost the substantia nigra pars compacta neurons and they're not going to come back, so the machine is permanently broken. Okay, so those are the key side effects of the first-generation antipsychotic drugs. The extrapyramidal side effects, and the major type of extrapyramidal side effect is drug-induced Parkinsonism, where you end up having very slow movements, very difficult to initiate movements, and therefore you end up moving around very little. And this is effectively similar to some of the negative symptoms of schizophrenia that we've seen, such as the psychomotor retardation. Okay, right. So those are very, very pronounced in the first generation antipsychotics. And as I say, in fact, all of the negative symptoms of schizophrenia can be made worse by these first generation antipsychotic drugs because they are just turning off the salience machine. Okay, so let's now go on to the second generation antipsychotic drugs. So we'll come over here and do the second generation antipsychotic drugs. So firstly, just a reminder of the difference between the first and second generation antipsychotics. The second generation, they still do turn off the salience machine. However, somehow they are better than the first generation antipsychotic drugs. They nicely turn off the machine as far as potentiating up these thoughts that shouldn't receive salience is concerned. So they do nicely get rid of the psychotic symptoms, but they don't make the negative symptoms worse in the way that the first generation ones do somehow. And in fact, some of them actually do help with the negative symptoms. So they don't generally have as bad extrapyramidal side effects as the first generation antipsychotic drugs. So the first generation antipsychotic drugs, they're really bad for the extrapyramidal side effects. The second generation ones, their extrapyramidal side effects aren't as bad. They're making the negative symptoms of schizophrenia worse. Isn't as bad as the first generation ones. Okay, so let's see some names of famous second generation antipsychotic drugs. So again, I'm only going to go through particularly important ones. There are absolutely loads of these. I'm going to go through 6 very important ones that are all still used. So the one that we'll start off with is by the name of quetiapine. Okay? A nice, effective second-generation antipsychotic that is used still. A major side effect of quetiapine is that it's quite sedating. So it makes you tired when you take it. Next second-generation antipsychotic. So the next one that I'm going to talk about is an extremely important one to know about because it's often quoted as being the first-line antipsychotic that someone with schizophrenia would be put on. and it's by the name of olanzapine. So an extremely important drug. As I say, this is the normal go-to drug for most psychiatrists who are treating someone with schizophrenia. They start them off with olanzapine. So I'll talk about olanzapine's major side effects in a moment, because it, along with two of the other second-generation antipsychotics, have quite bad metabolic side effects, and we'll talk about those once I've got the names of the other two on here. So another second-generation antipsychotic that's very important to know about is risperidone, and this is another one with reasonably bad metabolic side effects. In fact, quite a lot of the second-generation antipsychotics have bad metabolic side effects. So risperidone is another second-generation antipsychotic. Next up, aripiprazole. Now, aripiprazole is the nicest of the antipsychotics. It's the one with the smallest side effect profile. It generally doesn't give you bad extrapyramidal side effects, and it doesn't give you the bad metabolic side effects. And I feel like I should actually just talk about what these metabolic side effects are rather than hiding them away until I've listed out all the drugs. So olanzapine and risperidone and some of the other ones that I'm about to write down, the two others that I'm about to write down in fact, they have quite bad metabolic side effects. Okay? And in particular, the side effects that they cause are weight gain. So if you've got a patient who already is overweight, then you might be hesitant about putting them on a drug that you know is going to promote them gaining weight. In addition, it can also increase your risk of getting type 2 diabetes. So type 2 diabetes mellitus. And these side effects need to be acknowledged that they are there, and if you do have someone who is already diabetic with type 2 diabetes and overweight and at big risk of developing cardiac disease, heart disease, then you might want to consider a different antipsychotic from some of these second-generation antipsychotics. However, as I said earlier, olanzapine is usually the first-line antipsychotic that is used. Okay, right. So, in contrast, aripiprazole is the nicest antipsychotic. It usually doesn't have that bad side effects at all. So it doesn't have particularly bad extrapyramidal side effects like the first generation antipsychotics, and it doesn't have these metabolic side effects like olanzapine, risperidone, and the other two that I'm going to come to. So for some psychiatrists, aripiprazole would be the first choice of drug because of how few side effects it has. On the other hand, there is a body of opinion which says that aripiprazole is pretty useless. Usually it doesn't have much effect, so it's difficult to say whether this should be a first-line drug. It is nice. If it does work, fantastic, but often it doesn't work and you do have to then go on to another antipsychotic drug. Okay, but aripiprazole, you do see it prescribed a lot because of the fact that it is the nicest antipsychotic drug as far as side effects is concerned. Okay, continuing on, another important second-generation antipsychotic drug is amisulpride, and this is another one with very bad metabolic side effects. It is a powerful antipsychotic and it is still used, so it deserves a place on this list. And then the final one that I want to talk about here is the greatest of all of them. It is the strongest antipsychotic drug we have. If all the others fail, you will end up being put on this one, and if this drug fails, then we don't have a stronger drug. This is the best antipsychotic drug there is, and usually it will stop you hearing voices, it will stop you seeing things that aren't there, and it will get rid of the delusional beliefs, and it will then allow the person to have insight. And that's one of the key things about antipsychotic drugs that I should have said earlier, in fact. One of the key reasons we use these drugs is because people with delusional beliefs can have very little insight into their condition. So they might not know that they are ill, and they might be incredibly angry that they've been brought in for psychiatric assessment to a hospital, and they might want to go. And when you've got someone with very little insight into their condition like that, it's very difficult to get them to cooperate with these sorts of treatment, i.e. giving up recreational drugs and rehabilitation because they don't think there's anything wrong with them. And that's what antipsychotic drugs can be really useful for. They can give people insight into their conditions. They can get rid of the hallucinations. They can get rid of the delusions. They might make the negative symptoms worse, and they might have these other side effects, but they do at least give someone the insight that they are incredibly unwell, and then they will cooperate with the treatment after that. So that's one of the key uses of antipsychotic drugs, and I'll just write that down. So one of the key things that we use these for is giving people who don't have insight into their condition, returning them to a mental state where they're actually capable of accepting that they need help, and therefore they will cooperate with these more long-term treatment plans. Okay, so back to the final drug then. So this is a very important drug. I've built it up hugely now, and its name is Clozapine. So as I say, Clozapine is absolutely the best antipsychotic that we have. Unfortunately, it has several horrible side effects. So it has very bad metabolic side effects, along with olanzapine, risperidone, and amisulpride. So I'll draw a line there. But it, in addition, has another horrific side effect that means that its use has to be monitored hugely. And that horrible side effect is that it can cause agranulocytosis. So in a scarily high proportion of the people who take clozapine, it causes agranulocytosis. And what this means is it gets rid of all of the granulocytes in the blood. So there are lots of different types of white blood cells in the blood, and a category of white blood cells are known as the granulocytes, and this includes white blood cells such as neutrophils, eosinophils, and basophils. And these are really important white blood cells, particularly the neutrophils. And clozapine is capable of stopping the body from making these granulocytes, and that's known as agranulocytosis. So neutrophils, basophils, and eosinophils. So all these different types of white blood cells are known as the granulocytes, and they're made in the bone marrow, and clozapine in some people causes agranulocytosis. It stops the bone marrow cells actually producing the granulocytes, and therefore you get a huge drop in granulocytes within the blood, and that's called agranulocytosis, and that puts you at huge risk of infection. It hugely weakens your immune system because particularly neutrophils are extremely important for protecting you against infections. This effectively gives you an immunodeficiency, and you can then be killed by infections that wouldn't have previously killed you. So it's an extremely significant side effect. And for this reason, the use of clozapine is hugely restricted. It's only used in what we call treatment-resistant schizophrenia. So I'll write that down. So clozapine would only be used in people who are treatment-resistant. So it would be used in people who have already tried 2 antipsychotic drugs. So treatment-resistant schizophrenia. And the definition of this is they have to have tried 2 antipsychotics, which I'll just abbreviate to AP, and one of them has to be a first-generation antipsychotic, and one has to have been a second-generation antipsychotic. So generally, the classic combination is that they would have tried olanzapine first as their second-generation antipsychotic, then when olanzapine didn't work, they'd have then been moved on to haloperidol as the first-generation antipsychotic, and then when haloperidol didn't work, so it didn't get rid of the hallucinations and the delusions, then they will have been classed as having treatment-resistant schizophrenia, and then they can be prescribed clozapine. At least this is the way that it works in the United Kingdom. I don't know how it works in other countries. But when someone is put on clozapine, they have to then have blood tests very regularly. Initially, I think it's pretty much every day you have to have a blood test to make sure that your granulocyte level hasn't reduced. And all the time that you're on the drug, you have to have regular blood tests. They gradually space out the blood tests, I think it goes up to about every 2 weeks, finally, that you, once you've been on the drug for a long time and your granulocyte level has been stable for a long time, eventually it gets down to the point that you can just have blood tests every 2 weeks to monitor it. But initially, I think you do start off having blood tests every day to make sure that this isn't happening, and of course, if it does happen, then you'd be taken off the drug immediately. But despite it having these horrendous side effects, and despite its prescription being so complicated, it is still the best antipsychotic drug that we have, and it does save people's lives. It does help them repair their lives. In people who olanzapine, haloperidol didn't work, it didn't get rid of the hallucinations and the delusions, clozapine does work, and that can then help them to rebuild their lives, give them insight, and then other longer term treatments can help them to rebuild their lives. So it is a fantastic drug until we have something that is better. Okay, right. So those are all the antipsychotic drugs that I want to go through. So we've been through 10 drugs there, more if you count the different forms of zocilopentixol. So is there anything else I want to say about the different side effects? No, I think we've gone through all the different side effects for these different drugs. So I'll just summarize for the second generation antipsychotics. So we've been through these 6 different second generation antipsychotics: quetiapine, olanzapine, risperidone, aripiprazole, amisulpride, and clozapine. Overall, olanzapine, risperidone, amisulpride, and clozapine, they are infamous for having large metabolic side effects. They cause weight gain and they increase your risk of developing type 2 diabetes. Aripiprazole is some people's favourite antipsychotic because of the fact that it has the fewest side effects of all of them. It usually is very, very well tolerated. On the other hand, it's a lot of some people's least favourite antipsychotic because it's overall the one that's least likely to actually have an effect on the hallucinations and delusions. But if it does work, fantastic, we can keep you on a drug that isn't really going to do that as much harm as some of the other antipsychotics. Quetiapine, it's a powerful antipsychotic, but it does have this side effect that it's very sedating, so usually it's taken before you go to bed because of the fact that it makes you incredibly tired. Clozapine is the most powerful antipsychotic in existence at the time I'm making this video. Unfortunately, it has horrendous side effects and therefore is only used in treatment-resistant schizophrenia, where 2 antipsychotics or more have failed to actually treat the psychotic symptoms, and the major side effect that you have to be aware of there is that it can cause agranulocytosis, where the granulocyte level in the blood can fall to very low levels, and that can lead to opportunistic infections, which can then lead to death. Okay, so thank you for watching this video on schizophrenia. I hope you have learned something about this disorder.